Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for chapter 15, which deals with pregnancy, childbirth and puerperium, and this is the first part of chapter 15. Now let us see the overall guidelines that we are going to cover in the entire chapter. And in the current session, we will be discussing about the first one, that is general rules for obstetric cases. The overall guidelines are: the first one is general rules for obstetric cases. The second is selection of OB principal or first listed diagnosis. The next is pre-existing conditions versus conditions due to pregnancy. The next is pre-existing hypertension in pregnancy. And the next is fetal conditions affecting the management of the mother, HIV infection in pregnancy, childbirth and puerperium, diabetes mellitus in pregnancy, and long-term use of insulin and oral hypoglycemics. The next is gestational diabetes. The next is sepsis and septic shock complicating abortion, pregnancy, childbirth and puerperium. The next is guidelines regarding the puerperal sepsis, alcohol, tobacco and drug use during pregnancy, childbirth and puerperium, poisoning, toxic effects and adverse effects and underdosings in pregnant women, normal delivery code, that is O80, peripartum and postpartum periods, code O94, that is sequelae of complications of pregnancy, childbirth and puerperium. Next is termination of pregnancy and spontaneous abortions, abuse in a pregnant patient. Finally, COVID-19 infection in pregnancy, childbirth and puerperium. These are the overall guidelines that we are going to discuss in the entire chapter. And we will discuss each guideline in specific part. Now first coming to general rules for obstetric cases. That is the first main guideline. And the general rules for obstetric cases are again subcategorized into following categories. Guidelines regarding codes for chapter 15 and sequencing priority. The next is chapter 15 codes used only on maternal record. The next is final character for the trimester. The next is selection of trimester for inpatient that encompasses more than one trimester. The next is unspecified trimester. Next is seventh character for fetal identification. The guideline regarding the seventh character for fetal identification and completed weeks of gestation. This is a new point that has been added since October 2022. Completed weeks of gestation is a new addition. These are the overall subclassification of guidelines that come under general rules. So first coming to codes from chapter 15 and sequencing priority. The obstetric cases require codes from chapter 15 that are in the range O002 to O09A, pregnancy, childbirth and puerperium. And the chapter 15 codes, that is the O codes or chapter 15 codes, they have sequencing priority. Chapter 15 or O codes have the sequencing priority over the other chapters. Additional codes from other chapters may be used in conjunction with chapter 15 codes to further specify the condition. And should the provider document, this is important, should the provider document that the pregnancy is incidental to the encounter, then code Z33.1, that is pregnancy state incidental, should be used in the place of any chapter 15 codes. If the provider documents that pregnancy is incidental, then code Z33.1, pregnant state incidental, should be used in the place of any chapter 15 codes. The next is, it is the provider's responsibility to state that the condition being treated is not affecting the pregnancy. Now coming to second one, chapter 15 codes used only on maternal record. It is very important that the chapter 15 codes are to be used only on the maternal record, never on the record of newborn. The newborn record will have different codes and you can never use a O code in the record of newborn, on the record of newborn. Chapter 15 codes are to be used only on the maternal record and never on the record of the newborn. And final character for trimester. The next one is final character for trimester. Majority of the codes in chapter 15 have a final character indicating the trimester of pregnancy. The majority of the codes in chapter 15, they have a final character indicating the trimester of pregnancy. And if the trimester is not a component of the code, if the trimester is not the component of the code, it is because the condition always occurs in a specific trimester, or the concept of trimester of pregnancy is not applicable for that code. Certain conditions such as, for example, gestational diabetes, they occur only after second and third trimester. In such case, that particular code need not have a trimester component in it because the condition always occurs in a specific trimester. And second case, whenever the concept of trimester of pregnancy is not applicable, even in that case also, the codes may not have that component. And certain codes have characters only for certain trimesters because the condition does not occur in all trimesters, but it may occur in more than just one. Now coming to the time frame of trimesters. Pregnancy is categorized into first trimester, second trimester and third trimester. The first trimester ranges from less than 14 weeks 0 days. Less than 14 weeks 0 days. That is, less than 14 weeks means the patient comes under first trimester. The second trimester ranges from 14 weeks 0 days to less than 28 weeks 0 days. 14 weeks 0 days to less than 28 weeks 0 days. And third trimester, it ranges from 28 weeks 0 days until the delivery. From 28 weeks onwards, the pregnant woman comes under third trimester. These are the time frames for trimesters. First, second and third. Majority of the codes are categorized based on the trimester. Now coming to the example for codes with no trimester specification. As we have discussed earlier, gestational diabetes is one such example. The gestational diabetes usually occurs in the second or third trimester of the pregnancy, and hence there are no specific trimester codes for gestational diabetes mellitus. Here you can see the various codes for gestational diabetes. They are categorized based upon the control. If the gestational diabetes in pregnancy is diet controlled, then the code is O24.410. If it is insulin controlled, the code is O24.414. If it is controlled by oral hypoglycemic drugs, then the code is O24.415. And if it is of unspecified control, the gestational diabetes in pregnancy unspecified control, the code is O24.419. Here you cannot find a trimester component in the code. Now let us see an example where the trimester component is inbuilt. A 31-week pregnant woman presents with edema and proteinuria without hypertension. Here weeks of gestation are 31 weeks. So the patient is in third trimester because third trimester starts from 28 weeks 0 days until the delivery. So here the patient is 31 weeks. So the appropriate code is O12.03. Gestational edema, third trimester. O12.03, gestational edema, third trimester. And additionally, Z3A.31. It indicates weeks of gestation. 31 weeks of gestation of pregnancy. Now, usually the trimester is indicated in the final character. It can be a fifth or sixth character. Final character 1 indicates first trimester, 2 indicates second trimester, 3 indicates third trimester, and 9 indicates unspecified trimester. Here you can see the final character. It is a fifth character. 1, 2, 3, 4, 5. Here 3 is the fifth character and it indicates third trimester because the patient is 31 weeks pregnant. And the assignment of final character for trimester should be based on the provider's documentation of the trimester, which is indicated by number of weeks, as we have seen earlier. Number of weeks for the current admission or encounter. This applies to the assignment of trimester for pre-existing conditions as well as those that developed during the pregnancy. It can be pre-existing, for example, pre-existing hypertension, or those that have developed during pregnancy, that is edema and proteinuria, that is pregnancy induced. So this applies to the assignment of trimester for pre-existing conditions as well as those that develop during the pregnancy, during or due to pregnancy. The provider's documentation of number of weeks may be used to assign the appropriate code identifying the trimester. And whenever, this is important point, whenever delivery occurs during the current admission and there is a in childbirth option, certain codes in chapter 15 they have in childbirth, particular disease, in childbirth, in puerperium, in pregnancy, like that. If they have in childbirth and when the delivery occurs during the current admission and there is an in childbirth option for the obstetric complication that is being coded. If there is an in childbirth option for the obstetric complication that is being coded, then the in childbirth code should be assigned instead of in pregnancy and in puerperium. Whenever during the delivery, if the delivery occurs during the current admission and there is a in childbirth option for obstetric complication being coded, then in childbirth code should be assigned. Next point is when the classification does not provide an obstetric code with an in childbirth option. When the classification does not provide an obstetric code with an in childbirth option, then it is appropriate to assign a code describing the current trimester. Now coming to selection of trimester for inpatient admissions that encompass more than one trimester. So in certain instances, when a patient is admitted to the hospital for complications of pregnancy during one trimester and remains in the hospital into a subsequent trimester. For example, a particular complication has developed during the second trimester. For suppose, let us take an example, a particular complication has developed during the second trimester and the patient got admitted in the hospital at 26 weeks gestation. And the patient stayed in the hospital for 3 weeks. That is from 26 plus 3, 29 weeks. The patient got discharged at 29 weeks. That is, at the time of discharge, the patient is in third trimester. During the admission, patient is in second trimester. In such case, the trimester character for the antepartum complication code should be assigned on the basis of the trimester when the complication developed. On the basis of the trimester when the complication developed, not the trimester of the discharge. In our case, the complication developed in the second trimester. So, you need to code second trimester code only, no, not the third trimester, because at the time of discharge the patient is in third trimester but the complication developed in second trimester. So you need to code second trimester code only. That is the guideline. Second case, if the condition developed prior to the current admission or encounter and represents a pre-existing condition. In such case, trimester character for the trimester at the time of admission. During the time of admission, if the patient is second trimester, you need to code second trimester. During the time of admission, if the patient is third trimester, you need to code third trimester. If the condition is pre-existing or has occurred prior to the current admission or encounter. These are the two guidelines for inpatient admissions. Coming to unspecified trimester. Each category that includes the codes for trimester, as we have discussed earlier, has an unspecified trimester code that is indicated by final character 9. And the unspecified trimester should rarely be used because in 99% cases, the physician will document the weeks of gestation. And it should be rarely used such when the documentation in the record is insufficient to determine the trimester and it is not possible to obtain clarity. Obtain the clarification. Now, this next point, seventh character for fetus identification. Wherever applicable, Where applicable, a seventh character is to be assigned for certain categories that are O31, O32, O33.3, 33.6, O35, O36, O40, 41, O60.1, 60.2, O64 and O69. These codes, these categories have a special requirement for seventh character to identify the fetus for which the complication code applies. Seventh character is employed to identify the fetus for which the complication code applies. The code 0, seventh character 0 is for single gestations and multiple gestations where the fetus is unspecified. For single gestations and for multiple gestations where the fetus is unspecified. And when the documentation in the record is insufficient to determine the fetus affected and it is not possible to obtain clarification. Even in that case also, seventh character can be 0. Next, seventh character 1 through 9 are the cases of multiple gestations to identify the fetus for which the code applies. And the appropriate code from category O30, whenever we are employing the seventh character 1 through 9, appropriate code from category O30, which deals with multiple gestations, should also be assigned when assigning a code from certain categories like O32 that has a seventh character of 1 through 9. You will understand if you see an example. Certain codes, they need seventh character to indicate the type of fetus for which the complication code applies. 0 indicates single gestations or whenever you cannot determine the fetus, that is unspecified or single gestations. 0 is applicable. 1 indicates fetus 1. 2 indicates fetus 2. 3 indicates fetus 3. 4 indicates fetus 4. 5 indicates fetus 5. And 9 indicates other fetus. It can be 6, 7, 8, whatsoever. Now let us see an example. 37-week-old pregnant woman, twin pregnancies, presents with breech presentation of fetus 2. Twin pregnancy means there will be 2 fetus and the fetus 2 has breech presentation. So the code is O32.1XX2. Here the seventh character is 2. 1, 2, 3, 4, 5, 6, 7. The seventh character 2 indicates fetus 2. Maternal care for breech presentation fetus 2. And next, because it is a twin pregnancy, you need to code multiple gestation code O30.003. It indicates twin pregnancy, unspecified number of placenta and unspecified number of amniotic sacs, third trimester. Next, Z3A.37. It indicates 37 weeks of gestation. Now let us see a new addition, that is completed weeks of gestation. Guideline regarding completed weeks of gestation. In ICD 10cm, completed weeks of gestation refers to full weeks. For example, if the provider documents gestation at 39 weeks and 6 days, then the code for 39 weeks of gestation should be assigned, as the patient has not yet reached 40 completed weeks. That is the definition of completed weeks. The patient is 39 weeks 6 days, you need to code 39 weeks gestation only, not 40 weeks. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.